It's 9:03. May is Stroke Awareness Month, and every second counts when it comes to saving a life. And joining us this morning is Dr. Mohammed Farooq, a neurologist with Trinity Health in Grand Rapids, to help us understand the signs, risks, and what we all need to know to act fast in an emergency. Of course, fast is going to be one of the things that we talk about here. But first, Dr. Farooq, we want to ask you what a stroke is. You know, I think we all have heard of what it is. You know, some of us might be familiar with different family members. But from a doctor, what is that condition? What should we be looking out for?
Yeah, very good question, Tanner. Yeah, thank you for having me first of all, So stroke is basically a lack of blood supply to the brain, just like as simple. So if any blockage in the blood vessel in the brain, or if the blood vessel ruptures. So if any blockage in the brain, it is called ischemic stroke. And if blood vessel ruptures, it's called hemorrhagic stroke. So most of the strokes are ischemic stroke. Approximately like 85% of the strokes are ischemic strokes.
Okay, and that's exactly the diagram that we're looking at right now from the American Heart Association. This is kind of a visual representation. So can you describe what happens to the body when that happens?
Exactly. Very good question. So we can see in this diagram as they have highlighted very clearly, there is a clot formation in the blood vessel. When there is a clot formation, there is a lack of blood supply to the brain, and that area is damaged. However, luckily, we have some collateral circulation. Just like when main highway is blocked, what we do? We go on the detours, right?
Right.
The same thing here. So when the main highway is blocked in the neck, there are detours. So nature has its own mechanism how to prevent the complications. So when there is a blockage in the main blood vessel, there is some supply of the blood to the brain from other routes. So this is very important. As you mentioned in the beginning, every single second count in stroke care.
Yeah.
And you can, you'll be surprised, like if we don't take care of these patients right away, within 1 minute, we can lose approximately 1.9 or 2 million neurons.
Oh, wow. So it's significant brain damage that could occur as a result.
Exactly.
And it's so interesting because you have to really act fast to kind of save any brain function there.
Yeah, you absolutely do. It's something that affects a lot of people per year. Can you talk a little bit about some of the warning signs that people can look out for, or symptoms that they would be able to see if somebody were potentially having a stroke?
Yeah, thank you, Amber. So this is actually a very good point. So very easy method to remember. So be fast. As you mentioned, you act fast, so be fast.
And it's also an acronym, right?
Oh, yeah, acronym, yeah. So B is for balance, sudden loss of balance. So important thing to remember in stroke care is something happen all of a sudden like that. So in other neurological problems, so things can happen like slowly, but in stroke, it's all of a sudden. So B is for balance, sudden loss of balance. E for eyes. So if we lose vision in one eye or both eyes, or sometime patient can have like what we call diplopia, like double vision. So sudden onset of vision loss or double vision can be a sign of a stroke. And F is for face, like droopy face. And A is for arm. So what we do when we see stroke patient, we ask patients to lift the arms up. So if the one of the arm drift down, that can be a sign of stroke. And S is for speech. Obviously, somebody is having like slurring of speech or difficulty with speech or difficulty with comprehension. So speech is quite complex. So any difficulty with speech or understanding can be a sign of stroke. So when you see any of these signs or combination of these, so that is time to call 911.
And at that point, time literally is of the essence,
Exactly.
to your point.
Every single second count, and very important to remember. So please don't call your son, your daughter, or any other relative. Call 911.
Yeah.
When you call 911, EMS will be there, and they will bring you to the hospital, and you will go directly to the CT scanner. So, every single second is important. Otherwise, it can cause significant disability.
Yeah. So you have been talking about just kind of what to know and what stroke signs may look like, but what are some of the biggest risk factors that people should look out for with their health in general? Is there anything in particular that somebody can do maybe today to help prevent a stroke in the future?
Very good point. This is the whole thing, right? So primary prevention. We focus so much when something happens, right? But we don't pay attention how to prevent it. So primary prevention is the key for every single thing. So like just like high blood pressure, high cholesterol, diabetes, smoking, excessive drinking, drug abuse, sleep apnea is a big one. So many of us actually don't know, sometimes that sleep apnea can cause increased risk of stroke. And also the abnormal heart rhythm, like skipping a heartbeat. So if you feel you're missing a beat or irregular beat, please call your doctor and make sure they put you on a heart monitor and monitor you at least for 2 weeks or so. And also now doctors can put a monitor underneath your skin, and that can stay there for 3 years.
Okay, so there are some different ways that you can help prevent one in the future, but also it's good to know that there are all sorts of things that can kind of, impact whether you have a stroke or not.
Yeah, absolutely. There's a lot of different ways that people could be predisposed to strokes potentially with all those different lifestyle changes even potentially. But no two strokes are alike, I understand, right? And
Right.
would you be able to talk a little bit more about the different types of strokes?
Yes, exactly. So there are different types, like the ischemic stroke, as I mentioned, hemorrhagic stroke, and depending upon the location where the damage is. So this is important. So ischemic stroke is majority of the strokes, and the hemorrhagic stroke, there are two types. One is due to the rupture of the blood vessel, or there can be aneurysm in the brain, or abnormal like blood vessel, like what we call AVM. So those vessels can rupture and can lead to bleeding complication. So very important point to remember is like 80% of the strokes we can prevent. So this number is quite actually high. So if we are aggressive in controlling the vascular risk factors, so 80% of the stroke we can prevent.
So another thing that we want to talk about as well are maybe disparities that you see among different communities. We know that some African Americans and some Hispanic communities are disproportionately impacted by strokes. Why is that, and how can we bridge the gap to get those people the help that they need as well?
First of all, I would like to thank you, Tanner, for this. I'm glad you mentioned that, because there is a huge gap in the care in different populations. So just like Afro-Americans or Hispanic, so one factor is like genetic factor. They are more prone to have hypertension, diabetes, and other vascular complications. And the other thing is the awareness of the risk factors. So we need to create awareness in these communities, and they need to be up to the speed. What are the risk factors? What to do when somebody is having a stroke? So because of the lack of awareness, many of these patients don't come to ER in timely fashion.
Interesting. What about medications that are available? I know that there is a certain medication that you guys kind of focus on right now. What is that, and how does that kind of help bust clots up in this process?
Exactly. Things have changed quite significantly since I did my fellowship over the last almost 15 years. Now what we can do for a stroke patient, that is amazing. So if somebody comes to the hospital within the first 4.5 hours, we can give the clot busting medication right away, and that can help to break the clot. It's called TNK, tenecteplase. The other thing is nowadays doctors can go from your wrist or from groin and take the catheter up to the brain and remove the clot mechanically.
Wow.
And that can be done up till 24 hours or even beyond. As I mentioned, the collateral circulation. So if somebody has good collaterals and the blood pressure is on the higher side, so even after 24 hours, so if somebody is having a stroke or stroke-like symptom, please come to ER immediately.
Yeah, and one thing, we have about 30 seconds left. Can you give me one thing that you wish everybody knows about maybe stroke prevention or maybe stroke care in the future?
Yes, absolutely. So two things, just to summarize the whole thing.
Yeah.
Number one, 80% of the strokes we can prevent. If we take care of the risk factors, high blood pressure, glucose, cholesterol, do proper exercise, and watch what we eat, like Mediterranean diet, we can prevent 80% of the strokes. And number two, if you see somebody having a stroke-like symptom, please call 911.
Yeah, 911 is the biggest thing here, of course. Stroke Month, it's a way to highlight the importance of how fast to act, but also a way to highlight what symptoms people need to look out for. Dr. Farooq with Trinity Health, we really appreciate your time this morning.
Thank you for having me.
Of course, yeah, we'll have you back on the next Stroke Month.
I appreciate that.
Thank you very much.